Hello everyone, welcome to Nutritional Medicine by Lab Analysis. I'm Dr. Cyrus Thomas. I've been a chiropractic physician for 34 years and we're going to be talking about cancer today. I've got a lot of really interesting information to give you, things to make you really think about what is cancer and what is it compared to what everybody thinks it is. It isn't what everybody thinks it is, and I want to show you how that is true. We're going to be talking about doing medical analysis through blood test, urine analysis, and hair analysis, saliva analysis, stool analysis, using cancer markers, all kinds of blood tests, all depending on the person's individual case. Some people need very little testing, some people need more testing. We're going to be using nutritional treatment as medical treatment, okay? So nutritional treatment actually is medical treatment, and one does not have to get a prescription to a pharmacy to be actually doing medicine. Medicine can be done with herbs, nutrients, including vitamins, minerals, enzymes, amino acids, and the like. And it is a very serious form of treatment. Nutritional treatment does not treat the symptoms, it treats the actual cause of the problem. That makes a big difference. It treats the cause and it cures. It doesn't cover up the symptom, it doesn't make the symptom go further back, it actually cures the symptom. We're going to start moving a little faster now. So our show today is called Understanding Cancer. And since 1972, we've spent over $60 billion on the war on cancer, and it has not produced an unqualified cure for any type of cancer, according to Quinlan, a PhD who has written much about this. The big question is cancer localized or is it systemic? That means, is the tumor the cancer? Or is the tumor just a manifestation of a bigger picture, which is the systemic, the whole system picture? The surveillance theory, as it's called, of cancer says that, excuse me, cancer is popping up in all of us all the time, but is checked early in its growth by our own host defense mechanisms. We're talking about the immune system here. It keeps a check on cancer. Fortify the immune system. Whenever the immune system is shut down, the smoldering embers of cancer in all of us become a raging fire. Professor Bruce Ames of the University of California, Berkeley has shown that the average human cell, and there are some 60 trillion in the body, is subjected to 1,000 to 10,000 potentially cancer-causing DNA breaks each and every day. When DNA breaks, it forms essentially a retarded cell, a cell that doesn't know what to do, it doesn't know how to differentiate and become specialized. Those cells get in the way. Each cell needs to differentiate, be specialized, and know what its job is. Newer studies examining the role of the immune system in protecting us against cancer show that the average adult has one cancer cell appear each day. My bet is that it's much more than one, especially when a person starts to go downhill. Before fortifying the immune system with nutrients known to augment its function, the body can function the way it did before the number of cancer cells being produced became overwhelming. You do this by fortifying the immune system, and you return to that state where you were taking care of the cancer cells that were being produced by your body, because they're always being produced to some extent. We return to the state where you're able to handle it well by having a strong immune system. We are all forming cancer cells every day, and until we get sick, we are destroying them all successfully. Returning the body to the state where it was able to handle the amount of cancer cells produced daily is the key. Quinlan said in Beating Cancer with Nutrition, the best-selling cancer drug in the world is a mushroom extract called PSK, manufactured in Japan and sold throughout Europe and Japan. In Japan, only 30% of cancer therapy is from the big three. The big three is radiation, chemo, and surgery. Only 30% is done that way in Japan. That means the other 70% is done with nutritional means, most likely. Evening primrose oil is an accepted cancer therapy in England. In Germany, digestive enzymes and mistletoe, Iscador, are government-approved prescription cancer drugs. America is lagging well behind the rest of the world in cancer treatment. Why does the World Health Organization say that the United States is 38th in world health, 39th in infant mortality? The cancer rate has skyrocketed. Things aren't working very well in our system, and yet everybody thinks that everyone in the world wants to come here for the best medical care there is. Well, that's not the truth. Rich people and famous people in Hollywood, they usually go to France and Germany for medical care. That's where they are at the state of the art in testing new things, trying new things, and looking at disease and the reverse of it, healthcare, as a non-money making endeavor. It is a moral obligation to return a person to health, and yet in this country it has become a for-profit business. Sorry to say. To say that cancer is systemic, meaning it's something wrong with the whole body, not just the tumor itself, is not good news. Why? This means that accepting this premise forces us to want to cure it systemically and not to be duped into thinking that shrinkage or removal of the tumor by surgery has cured us. Our entire medical system has us believing now that if you form a tumor, now you have cancer. You didn't have it before the tumor, but now that you have the tumor, you have it. And we're going to shrink that tumor by chemo or radiation, or we're going to cut it out of you by surgery. And then we got it all, so the cancer's gone, you're cured, you're good. That's not the picture at all, and that's not how thousands of practitioners around the world look at cancer. We say that the body is forming cancer cells all the time, and that these cells, when they begin to accumulate, that accumulation, which we call a tumor, it's really just a storage facility for those cancer cells. 1 in 8 women will be diagnosed with breast cancer. In the 1900, 3% of the deaths in America were from cancer. In 2005, 24% of deaths were from cancer. And today, 43% of people will be diagnosed with cancer. Is something wrong? Well, the classical homeopath, of which classical homeopathy is very popular in South America, Mexico, India, and all over Europe. It's a medical specialty in France. A classical homeopath is more aware of the suppressive effect of modern medicine than any other type of doctor. Here is how homeopathic doctors allocate the causes of cancer. Homeopaths think that 60% of cancers come from suppression by antibiotics and vaccinations and psychotropic drugs, antifungals, asthma medications, cold, flu, and fever suppression, and cold and flu vaccinations. They believe that 30% of cancers are caused by faulty nutrition, and they believe that about 10% come from birth propensity, meaning you're born with a likelihood to get cancer, and from the toxic environment that we live in today. Some people would like to think that's completely responsible and that they don't have to make any dietary changes. They're not responsible for all the medicines they've taken in the past, which have caused suppressions, and that they think that their vaccinations didn't cause any problems at all either. In 2007, 180,000 new cases of breast cancer were estimated in the United States alone. That's 180,000 mothers, daughters, and friends facing the same diagnosis as my patient, for example, being told that they have so many years to live and that they will be constantly battling the side effects of medical treatment. What an awful diagnosis and prognosis it is to get cancer today in this country. Here's a case history of a person who had 3 metastasized cancerous lymph nodes. Let's talk about the word metastasized for a minute. We have the impression that the tumor is the cancer and we don't want it to spread. So we have to kill it, take it out so that it can't spread. But if it's systemic, it's really already spread. It's really already everywhere. And that storage unit, the tumor, of the cancer cells, of course, it's not good if it grows too big because then it begins to press on things and we need to shrink it or remove it or shrink it naturally through natural means. In some ways, we can't allow tumors to keep on growing. But to think that it jumps from the tumor to another spot in your body called metastasis is faulty. Most doctors who do holistic medicine don't believe in that. We say that the reason it then appeared in another area is because that tumor had already gotten too big and the body wanted to form another storage area for all the cancer cells it's been producing and for the fact that their immune system has been unable to deal with those cancer cells. This person had a tumor marker of 185.7. Their initial symptoms were breast cancer, ductal carcinoma, high blood pressure. They were taking Norvasc and hydrochlorothiazide. They had hot flashes and they were on Fosamax for osteoporosis. Well, what came of this individual? In just 4 weeks, the tumor marker had dropped from 185.7 to 79, a drop of 106.7 points. They then refused chemo and radiation treatment. This is when they were on a nutritional program. They then refused chemo and radiation treatment due to outstanding results. The patient is elated. The blood pressure is consistently improving. Between May 4th and August 17th, the cancer marker dropped a total of 156 points. The results speak for themselves. You do not have to pollute your body with radiation and chemotherapy treatment to reduce cancer cells. There is an easier way to do it. MDs usually do not do tumor markers until after the diagnosis, the biopsy, and the treatment. Why? Well, they have to wait until the cancer is big enough to see it. Through a mammogram, palpation, which is touching, through x-rays, CAT scan, or bone scan. Excuse me. They have to wait to see it. But that's not the only reason. So, for example, if you ask your general practitioner for some cancer marker tests, they usually refuse to do them. But if you can get the person to do them, and then the results of those tests are a bit high, now you're scared that you have cancer, and you might drop that GP and go to a specialist, an oncologist. Now the GP has lost his or her patient, and they're not happy about that. Because cancer markers don't always mean cancer. They also can go up with inflammation, meaning that there's some swelling of the tissues inside the body, something's not going well. Usually it's food-induced and drug-induced. So we educate patients that we're going to do some cancer marker studies, but it doesn't necessarily mean there's cancer. It means there's inflammation. Of course, inflammation can lead to cancer if that inflammation is there for decades in a row. That only makes sense. So we educate our patients not to be too afraid about the results of the CA markers. And if the CA markers are high, by law, we have to say that we're not treating their cancer. We have to say that we're treating them so that they will cure their own cancer. And there's many, many things that can be done. You can also work with an oncologist and get their advice at the same time. And you might opt to do nutritional program and surgery down the road if the tumor gets too big. There are lots of things to talk about when it comes to this. Cancer treatment, is it social conditioning? We are taught to fight the cancer, to beat it, to put up the good fight, and to almost be ashamed if we do not. We are encouraged to believe that if nutritional cures worked for cancer, then the hospitals would be using them. Do you believe this? Do you believe that if there was a process of treating cancer at 2% of today's present cost, do you think the hospitals would want to adopt that? The Hospitals Association in the United States is only topped by the pharmaceutical interests, big pharma. Hospitals are making a fortune in this country. 17% of our gross national product, I believe, goes to health care. We did a show on that a couple of weeks ago. We are all forming cancer cells at this very moment. Our immune system knows how to phagocytize them, which is to destroy them. When the immune system malfunctions, the number of cancer cells in the body becomes overwhelming and tumors begin to form. So tumors are a clear marker that you've let things go too far. And it's going to be a process of reversal to get that to change. Stopping medication. Sorry for the typo there. No one needs to be told to stop any medications or treatments. When they begin to feel better, they will want to stop them, and all on their own, with their doctor's advice, perhaps. Don't make changes to your medications just because you all of a sudden decide one day medications aren't good. Make a change to your lifestyle. Make a change to your diet. Make a change to the nutritional supplements that you take. Only the very best qualities, with practitioners like myself who use only the very best. We usually don't buy anything from health food stores. Those companies are competing with each other, and we use companies that don't compete that way. We think we get a much better product. Here are some frequently used blood tumor markers. CEA is carcinoembryonic antigen. CA2729 is for breast cancer. CA199 is for breast cancer. Prostatic specific antigen is for prostate cancer, and CA125 is for ovarian cancer, pancreas, liver, and other pathologies. Tumor markers are not always used to screen for cancer, but they do indicate pathology. That pathology is usually inflammation. Mostly associated, CA125 is mostly associated with ovarian cancer, but it may also be elevated in endometrial cancer, fallopian tube cancer, lung cancer, breast cancer, cancer of the gastrointestinal tract. So there isn't just one cancer marker for each type of tumor. There's an overlap of each of them, and it can be difficult to ascertain exactly which body part is having trouble. However, if you initiate a nutritional program, make changes to the diet, you can then retest these on a weekly or monthly basis and see what progress is being made. That's why they're so nice. We do a blood analysis with 52 different items. We then color code them. Code blue, red is at risk, yellow is warning. This person didn't do so well on the first test. We later tested it. They did quite a lot better 5 months later. We're testing for all of the different red blood cell tests, white blood cell tests, electrolytes, kidney function, liver function. We're looking at, of course, liver enzymes here. I'll need my glasses, thyroid, and white blood cells, the works. It's a very complete test. Most physicians' offices are testing about 25, 26 items. We're doing 52 here. We also use a much narrower range. So rather than saying if you're outside to the right or left here, you're not doing well, we bring the range into here and say, if you're here or here, you're probably not feeling too well. So we try to bring people into a functional lab range. We do hair analysis because each hair follicle is fed by an artery and a vein. And when we make a shaft of hair, we're actually taking a picture of the different substances that are in the blood. What we're looking for most is heavy metals in the top portion of the test. And when they increase, those heavy metals cause free radicals. They get in the way of enzymatic processes, interfere with liver function. We like them to be down to 0. There are some other good metals and some minerals that we measure too, and we would like them to be in the center range here, not too high, not too low. We do a computerized cross-referencing of the blood, the patient's 6-page questionnaire, and the hair analysis, stool, urine, saliva, whatever other testing we do, cancer markers. And in that diagnostic findings, this is an example of a coronary risk assessment portion of it. The total cholesterol was 188, different cholesterols, coronary risk assessment was probably protected. It's quite a detailed evaluation that we goes through. And we talked to you about all the different types of fats that there are in the blood and the different types of cholesterol and what the true picture really is there. That's a whole show in itself. A possible cardio effect, the creatinine kinase in this individual was a little high and the C-reactive protein is high. This mildly elevated CK commonly associated with breakdown of muscle, either cardiac or skeletal, etc. A CRP close to 0 is desired. The finding is supported by the fact that in the blood test there was a high blood creatinine kinase. There was also a high blood liver enzyme. There was a high blood C-reactive protein. There was a low blood hematocrit, the percentage of blood that is actually red blood cells. This finding was also associated with their questionnaire where the person said they were taking Lipitor, Prilosec, Naprosyn, and Zetia. Nutritional recommendations were in flavonoids or turmeric for this particular aspect of their health. We looked at inflammation of the liver because the SGPT enzyme was a little high. This is a mild inflammation of the liver. It was supported by these 4 different blood tests, and the findings are also associated with diflucan, Lipitor, Prilosec, and naproxen. They were recommended milk thistle and vitamin C. Those are recommendations that we use. Now, this is what the report actually looks like, where these are all the symptoms the patient said that they've had over the last year or two. We're looking at primary findings, the medications that they're on. We give the side effects of all those medications. I tell you how to interpret the blood, and you get a copy of this too. We tell you how to interpret this test. This person could have a possible diabetes. There is some inflammation. There is some anemia. There's a possible infection going on. They had some very interesting hair values like high arsenic and very low chromium in the hair, high hair chromium, high hair mercury, and with some nutritional recommendations and, of course, lifestyle changes such as exercise, how to use water, always buy a non-fluoridated toothpaste. Don't swallow your toothpaste, by the way. So this is a 15-page report that correlates everything together. We really think that it's medicine at the state of the art right now. So this person had had numerous blood tests over the last year or two, and that's the beauty of comparing things this way, is that when we color code, we can see the progress that the person makes over time. And if it's a chronic disease, it might take a year or two to resolve many of the issues. Nutritional recommendations are made by this consortium of nutritionists that ends up leading to this prescription. And I'll see if I can get this to go to the next one. This is just a video of some of the nutrients that we carry in the store. This was systemic formulas. These are Borky and Tafel homeopathic products. These are products for a parasite program. Standard Process is the company that's been using, that's a great powdered multi, by the way. Standard Process is a great company that's been using food to actually make their nutritional supplements with. They've been doing that since 1929. Most cancers are seen in people with low functioning thyroid. Low functioning thyroid. So that means that doesn't involve me, because I was told that I had low functioning thyroid, and I'm taking thyroid medication. So I must be okay. I'm not going to get cancer. Well, consider this. Replacing the body's thyroid hormone with thyroid pills encourages the thyroid to not make its own thyroid. Yet most of the population is doing this. It is actually modern medicine's view today that if we can put the thyroid to sleep, not have it make its own hormones, by supplying the hormones in pill form for the rest of your life, what a market that is, then we can control your hormone level and not leave it up to your thyroid. Well, I don't want my thyroid put to sleep. I want it to be alive, and it's an incredibly complex organ. It's communicating with the brain. It tells all of my cells how high to rev up or not to rev up. It's very important to treat it gently and kindly. PSK is that mushroom I was talking about that's made in Japan. It's isolated from a mushroom called Trametes versicolor. The MD Anderson Cancer Center reported that it is a promising candidate for chemoprevention due to the multiple effects on the malignant process, limited side effects, and safety of daily oral doses for extended periods of time. There isn't an oncologist in this country that would give you the substance, and there isn't a hospital that recommended. In fact, if any doctor was to recommend this in the hospital, you'd probably be brought before the board for practicing quackery. And yet only 30% of cancer treatment in Japan is done with chemo, radiation, or surgery, the big three. Something to think about, what other countries are doing. If you saw the movie Sicko by Michael Moore, you see how well medicine is being practiced in other places. But our sort of capitalistic for-profit system here is failing dramatically, and the World Health Organization's scoring of us as 38th in World Health, I think, is proof of that. In closing, treat the person, not the cancer. Treat the person so that their own immune system can begin to react to the cancer cells that are being produced at too great a rate for the body to destroy them. When there are too many cancer cells floating in the blood, the body stores them as tumors, and tumors grow and get in the way of other body parts. This is my office, this is my phone number, this is my website. Many more things are there. It'll also show you how to watch more of these programs on YouTube. All of these programs have been stored on YouTube and can be viewed. www.integrative-alternative-medicines.info. If you go there, you'll have fun. You'll see there's lots to do. You can also watch this program every Tuesday night at 8 o'clock. We've been airing these now for a couple of years at least. There's numerous programs. We cover thyroid issues. We're covering immune system, cholesterol, thyroid, pancreas, liver, kidney, anxiety, Alzheimer's. We've done shows on a lot of different topics. Certainly hope you enjoy this. I enjoy doing this community service for you. I'd like to thank the Community Media Center of Marin for making this possible. And there's some more information. If you want more information, call me. I'll lead you to a place where you can get more information. Thank you for watching the program. I'm Dr. Cyrus Thomas. Hope you've enjoyed it. Good night.